I would like to have Professor Indika Dirasinghe. Is one of the pioneering researcher in the field of nutrition, and is attached to the Nutrition Research Center of Illinois Tech Institutes, US, and so he's here with us of working on a collaborative project where we will be working on making the claim for our Ceylon black tea for the international market, of getting any possibility of that to be used as a preventive measure as for the NCDs. So these are the main objective of the project. So we would like to have Professor Indika's thought on this project, and then we'll discuss of what exactly the workflow that we are going to plan for this particular work.
Yeah. So it is. Thank you very much for the introduction, and I'm very glad that to initiate this discussion and our collaboration. And as you can remember, that we initiated this a couple of years ago, and we had a lot of systematic literature review, and we had brainstorm sessions, and then we identified Ceylon tea is one of the best therapeutic targeted approach for pre-diabetic, because in the modern day world, the pre-diabetic is a silent killer. As we all know that before the diabetic, people get into this pre-diabetic stage, and many people were unaware until they reach the diabetic, and there's an opportunity in that period to become healthy. And unfortunately, medical interventions are not possible during the pre-diabetic. It is the lifestyle and dietary modifications strategies, and it is actually many literature has shown that that's the best approach because it's economical, and then there's no side effect, and sustainable, and because of those it has gained significant attention. And if you look at big studies like Enhance and DASH diet research project, and they have clearly showed that inclusion of fruits and vegetables, especially food that has polyphenolic compounds, has significant benefits. So the Sri Lankan tea has gained substantial attention recent years due to its polyphenolic compound, especially the black tea and even green tea. And it is when it comes to the Ceylon tea, and everybody knows that you can't beat that taste. And being in United States for many years, I know that whenever we go to any hotel or any places, the Ceylon tea is the best tea, and it is a landmark figure everywhere. So and then when you look at the US market, it has saturated because it's a big population, 340 million population, and there are coffee drinkers and the tea drinkers. So tea drinkers have saturated pretty much. So now if we need to have a market evaluation to enhance our revenue, so we need to add the value added concept, and so we have to think about science as well as economic impact, especially when it comes to the Sri Lankan situation. So there's a sound scientific background, and so that is why we thought to persuade this one, and this is the right direction. It is not only helping the consumer, and it is helping the tea growers, it is helping the scientists, and it's also helping the economy. So the right approach is to go through this very rigorous scientific way, and so that's why we initiated with the preclinical studies. And so when we get the preclinical studies, which we have received data, and they're very promising, so that will provide us a really good base to our next level, which is the clinical studies. And when you design the clinical studies also, as we discuss, we are going to do it in a very high level with power calculation, and then when we even the selection of population, study design, and we are going to follow the good clinical practice protocol, and all the ethical review committees and clinical trial registry. So that way that when we give when you get the data from very high level of research, we can utilize that data and take into a different organization like FDA or EFSA, European Union, to file some kind of a claim, valid health claim. Of course, you have to have a good data. We may have to repeat the experiment a couple of times, but we have to start something. We are thinking about, not tomorrow, it's going to take years, but we have to start somewhere. And so we have initiated, and it's progressing and the data looks really good, and we have a good team, more and more collaborators coming, and now we need funding.
Yes.
and you have been actively trying to persuade the money, and we need to start something.
Absolutely.
Something small level, which can lead to a next level.
Absolutely. That's the whole concept here, because I believe that if it is really want to make it our market open into the outside world, it is not the product at the end of the day, but it's what exactly we claim in terms of the health. So this is what exactly we are making the pathway forward. And I would like to give a little bit of emphasis of the project, where we engage with the multiple stakeholders for this particular work, because we need different aspects to be addressed, where we work in the preclinical aspect, where we have already done now, and then the next phase will be the clinical phase, and we need the clinician engaged, and then the other technical staff engaged, and the researchers engaged, and the statistician engaged. So this is what exactly we are working right now.
Right.
And so what exactly the gap, as you correctly mentioned, the funding. So the funding, of course, now what exactly the preclinical study we have done with the internal funding that we made it. And so then it will be, I believe that it will be the foundation for us to claim for a better funding in future. Perhaps, so as you well aware that we are constantly working with the industry, see the possibility of getting some funding from the industry, because at the end of the day, if we make a claim for this, for the Ceylon black tea as a potential prevention for the NCDs, what exactly the claim is there, so the benefit goes to the industry. So I believe that the industry should be one of the principal stakeholder for this year. So that's what exactly we are planning. So I think the preliminary outcome is very promising. And then, so based on that, we think that with your existence, with your support, we can go for the next level of the work that we are planning for.
Yeah, exactly. So this is a classical project that we can do the industry, government, and academic collaboration.
Absolutely.
Because any project that has to be between those three entities, so that you can take into the very high level. Because government cannot support alone. The academia has the brain, but we don't have money. The money has to come from the industry.
Absolutely.
And the government is the regulatory agency, which they will facilitate all the regulatory aspect and the financial aspect. And everyone is going to get benefit.
Absolutely.
Yeah.
Right. Okay. Thank you.
Thank you.